Good afternoon and welcome to the July 2024 Pitt County Department of Social Services Board meeting. I would like to call the meeting to order and observe a moment of silence. Thank you. Next, we'll have roll call.
Okay. Chairman Dancy,
Here.
Member Dibble,
Here.
Member Anderson,
Here.
Member Pilgrim,
Here.
Member Perkins Williams. Everyone is present except for Commissioner Perkins Williams. She is attending a National County Commissioner conference this week, so she is unable to be here.
Can I have a motion to excuse Commissioner Perkins Williams?
I'll make a motion to excuse Commissioner Perkins Williams' absence for the County Commissioner conference that she's attending.
Second.
Thank you.
Okay.
All in favor?
Aye.
Next, we're going to have organizational items.
Okay. Calm down. Okay, so you put your left hand on the Bible and raise your right hand. Okay, and just repeat after me. I, Sue Ann Pilgrim,
I, Sue Ann Pilgrim,
do solemnly swear or affirm
do solemnly swear or affirm
that I will support and maintain
that I will support and maintain
the Constitution of the United States,
the Constitution of the United States,
and I, Sue Ann Pilgrim,
and I, Sue Ann Pilgrim,
do solemnly swear or affirm
do solemnly swear or affirm
that I will be faithful and bear true
that I will be faithful and bear true
allegiance to the state of North Carolina
allegiance to the state of North Carolina
and to the constitutional powers
and to the constitutional powers
and authorities which are
and authorities which are
and may be established by the government thereof,
and may be established by the government thereof,
and that I will endeavor to
and that I will endeavor to
support, maintain, and defend
support, maintain, and defend
the Constitution of said state,
the Constitution of said state,
not inconsistent with
not inconsistent with
the Constitution of the United States,
the Constitution of the United States,
to the best of my knowledge and ability,
to the best of my knowledge and ability,
and I, Sue Ann Pilgrim,
and I, Sue Ann Pilgrim,
do solemnly swear or affirm
do solemnly swear or affirm
that I will well
that I will well
and truly execute the duties
and truly execute the duties
of my office
of my office
as a member of Pitt County Board of Social Services
as a member of the Pitt County Board of Social Services
according to the best of my skill and ability,
according to the best of my skill and ability,
according to law,
according to law,
so help me God.
so help me God.
Welcome aboard.
Thank you.
Okay, so now we have the election of chair and vice chair. Would you like me to read the rules of procedure on this?
Yes.
Okay. I thought I had it marked. Okay. The chairman shall preside over the board for the election of office for the following year. The board shall elect a chairman and vice chairman from among its members, who shall then immediately assume those positions for the ensuing year. Any board member may nominate the current chair or vice chair for a second term. It is not necessary to open or close nominations by motion. You can just make a nomination. If the chair is not elected for a new term, the vice chairman shall be nominated for the role of chairman. Any member may nominate any other member for vice chairman. Once all members have had an opportunity to make a nomination, the board shall vote with the last nominee being voted on first and continuing in reverse order. The title of chairman and vice chairman shall refer to persons who hold this position, whether male or female. Okay. So, nominations for chairman for this next coming year.
I make a motion that or I don't think so, I make a motion, I nominate that Jerome Dancy remain chairman for one more term of the Pitt County Department of Social Services Board of Directors.
Okay. Any other nominations? Okay. Congratulations, Chairman. You were doing
I
it
accept.
again. Okay, good. Okay, now we will open up nominations for vice chair.
I nominate Colleen Dibble as vice chair for the Pitt County Department of Social Services Board.
Okay. Any other nominations? Congratulations.
I also accept.
Okay, good. So we're gonna do a quick seating arrangement change, and then we can move on to the next item. Okay? If you guys wanna switch. The next coming year. So, the next item is the rules of procedure. So this are the rules and the guidelines that we go by, for the year. I do believe they were sent out, for everyone to review. Has everyone had a chance to review them?
Yes.
Okay, so I would just need a motion to adopt the rules of procedure for fiscal year 24 and 25.
I make a motion to adopt the rules of procedure for year 2024-25.
Okay. Second?
Second.
Okay, so we have a motion to approve the rules of procedure by Member Anderson and a second by Member Pilgrim. All in favor?
Aye.
Aye.
All opposed? No. Okay. Motion passes unanimously. Okay. Approval agenda?
Okay. Do we have any public comments?
No, we do not. I'm sorry. We need to do approval of the agenda as well.
Okay. Are there any revisions to today's agenda?
I would recommend adding a closed session to discuss personnel to the agenda.
Can I have a motion to accept today's revision of a closed session after?
I will make a motion that we accept the revision of adding a closed session to the end of our agenda to discuss personnel issues.
Second.
Second.
Thank you. All in favor?
Aye.
Aye.
Opposed?
Okay. We're good.
All right. You all should have seen last month's minutes. Do we have any changes or revisions to last month's minutes? Can I get a motion to accept last month's minutes?
I'll make a motion to accept last month's minutes.
I will second the acceptance of last month's minutes.
Okay.
All in favor?
Aye.
Opposed?
Okay.
All right, next we're going to have recognitions.
First, I want to congratulate Chairman Dancy and Vice Chair Kibble. Thank you for coming on board and being helpful and supportive. I was asked, we had a new state person come in yesterday who's the regional director for Region 5, and she said, what's one of the best things about your job? And I said, the support that I get from my board. So thank you all for what you do. I appreciate it. So what we'd like to do is start with our introduction of new employees. These are folks who decided to join the Pitt County family. And so as I call your name, if you could just come up to the podium, adjust your microphone so that we can hear you. Introduce yourself if you'd like to talk a little bit about your experience and how you came to Pitt County. We'd love to be able to hear it and welcome you. So the first person I have on my list is Carmen Walker. Is Carmen here? Okay, Carmen.
Hi, my name's Carmen Walker. I am a new CPS investigator into Pitt County. I've been here about a month now. I'm also new to North Carolina. I just moved here about a month ago from Kansas, so happy to be here.
Welcome.
Thank you.
To all
Welcome
of us.
aboard.
Yes.
Drayuna Cooper.
Hello, everyone. I'm Driana Cooper. I'm new to assessments. This is my third county. I've worked for Alamance County doing adult protective services, and I worked for Guilford County doing foster care and adoptions. So happy to be here.
Thank you.
Thank
Welcome
you.
aboard.
Welcome.
Thank you. Jacqueline Rivera. Hi, Jacqueline.
Hi, I'm Jacqueline Rivera. I am from West Virginia. I've been working here for, I think it's my third week. I'm enjoying it. Thank you for having me.
Welcome.
aboard.
Thank you.
Vicki Blackwell.
Hello.
Hi.
I'm Vicki Blackwell. I'm from Snow Hill, North Carolina, but I reside here in Greenville. I work with DSS in the Family and Children's Medicaid Department, and I look forward to being here quite some time.
Thank you.
Thank you.
Welcome aboard.
Ashley Price. Welcome, Ashley.
How you doing?
Good.
I'm Ashley Price. I'll be working with DSS Family and Children Medicaid.
Thank you.
Thank
Welcome
you.
aboard.
Welcome.
Kiara Clark.
Good afternoon. My name is Korea Clark. I'm gonna be working with food stamps. I'm an intake in food stamps, sorry. So thank you for having me.
Thank you for
Thank
being
you.
here.
Welcome aboard.
Diamond Jones. Okay, thank you. Tyasia Chapman.
Hello, my name is Tyja Chapman. I also work at DSS in the intake, family and children intake. My experience has been good so far. I'm really happy to be joining y'all. Thank you for having me.
Thank you.
Thank you.
you for being
Welcome
here.
aboard.
Kiana Tyner.
Hello.
Hi.
Hi, my name is Kiana Steiner. I am here at Pitt County with food stamps determination. I come from Lenore County, and I look forward to being here long term. Thank you.
We look
Thank you.
forward to
Welcome.
having
Thank
you.
you.
Thank you.
Natalie Williams.
Hello, I'm Natalie Williams. I recently graduated from ECU and I came back to work full-time as a permanency planning social worker after my internship.
Wonderful. Welcome
Thank you.
aboard.
Glad to be back.
Welcome.
And Lakeisha Brown.
Hello, everyone. I'm Lakeisha Brown. I am redetermination for a long-term care SA and CAP. I came from Lenore County, and then before that, Mecklenburg. So I'm happy to have found a home. Thank you for having me.
Thank you.
Thank
Welcome
you.
For
aboard.
being here. Welcome.
Thank you to all the new hires and welcome aboard. I've heard a couple of, I'm looking for a long-term, a family. We're looking to have you long-term for a family. So you all can be excused or you're welcome to stay for the rest of the meeting.
Thank you.
Take care.
Thank you.
Next, we're going to have items for report. Brian.
Good afternoon. In your board packet are the Medicaid report card for June and also the report of applications received and applications processed. For the month of June, for the medical assistance applications that are in the disability category, MAD, we processed 76% of applications processed were processed timely. In the other category, that's all Medicaid. All other Medicaid programs, we process 67% timely. We have been approved in previous months where we're not meeting the 90%. We've received waivers, and the waivers are based on the volume of applications that we're receiving. A lot of it is due to Medicaid expansion and also the vacancies and the training process that's ongoing within the division when we're bringing in our new hires. But we're moving in a good direction. If you look at the number of applications received and number of applications processed, we had 1,785 pending at the beginning of June. We received 785 applications, and staff processed 1,269 applications. So when you look at the right column, the number of applications processed is now going back up. We do have paid overtime in place for staff. They are receiving pay for overtime that they work. And as we mentioned before, we're still contracted with an agency which specializes in eligibility determination. And as you saw today, we are continuing to bring staff in all the program areas, but many of you heard from today are working in the Medicaid area. So my thanks. We have a great team with the supervisors, the program managers, the staff. Everybody is working together on this Medicaid project, and also the other program areas as well. We have the same situation in each of the program areas: Medicaid, food and nutrition services, and workforce family assistance. So without the staff and the teamwork that we've got going on, it would not be possible. But I'm happy to answer any questions you might have about the report.
Brian, I actually sent you an email, I think earlier in the week, late last week,
Yes.
asking about your staffing.
Right.
You want to kind of, I think
And,
you said you're in a good place there?
We are getting in a better place. We still have some positions that have closed that we're screening applications and interviewing for. We have staff coming in next week on Monday. New hires are starting on Monday. We are continuing the training process that for new staff. That's going well. You're not seeing as many positions posted now because those are the positions that we're working on. Although we will have some, we will have a few posted. A few will be coming, but once we get our applications, we can post for the receipt of applications for the 4 new triage positions in the triage unit. They will be income maintenance caseworker 1 positions, and we're waiting right now on state approval of the job descriptions. And once we receive that, we'll be able to post those. So there will be a few more forthcoming that will be posted. But right now, there are not as many showing up because we're working on those positions.
Thank you. And the allowance of overtime with this staff really paid off?
It is. It is because, you know, previously we had it and then we did not have the authorization for it. And the fact that it's back, it is making a big difference. And we're happy that they are able to receive pay for the work as opposed to comp time being added on to, you know, time that people haven't been able to take because they're here working. So the pay is something that it's well-deserved, I'll put it that way.
Okay, thank you, Brian. Any other questions for Brian?
Brian, if you could just speak to when a new hire comes in with no experience and they have to go through the training process, how typical, or what's the typical time frame for them to actually be able to start taking cases?
Typically, it typically takes about 9 weeks.
So 2 months?
Before they are given applications, and then, of course, at that point, they can't, they're not going to be processing what somebody that a seasoned employee would be processing. But because they have to be trained in the automated case management system, NC Fast, they have to be trained in the program area that they're coming into. So even if we hire somebody, that it definitely helps having experience, and it helps having the 2 courses at Pitt Community College. It does get a start, but if they've not worked in the program area they're hired into, then they have to learn the program policy as well. So that's why people think that sounds like a long time, but that's why.
And I wanted to speak to the extra positions that we were able to get through the budget process for triage. So one of the ongoing issues that we have are our staff not being able to get the cases processed. So the idea of the triage unit is to be able to take some of those calls or walk-ins away from having the workers be able to be, we don't want them interrupted doing the processing of the applications, but instead using this triage team to be able to take those questions, take those phone calls and meet with folks. And so, Brian, in addition to the 4 positions we have, how many does Thomas have currently? Like, how many will there be in total?
Well, we're looking at having 3 added that are already part of his section, which would give us a total of 7.
Okay.
To do the specific triage piece, that piece of it. Now, he has additional staff. He has other staff that do other functions of customer care, but initially, we've identified 3 that could work with the 4 to give us 7. Because what we've been doing initially is we've been doing sort of a rotation so that caseworkers can currently have some uninterrupted time. They all do a rotation in their own triage for a specified day or portion of a day. But when we move to having the 7 in place, then we can free up those that are on rotation to just strictly focus on the casework.
Thanks, Brian.
Thank you.
Brian, are you able to cover the items for decision for Sonia?
I can. I can step in for her. Yeah, she and I collaborate on this plan each year because part of it is low-income energy assistance, part of it is crisis intervention program. Both are programs to us. Well, low-income energy assistance assists with heating because it's a winter season program, but the crisis intervention program, it operates 12 months, the full fiscal year. And this is our annual plan. The outreach plan shows how we promote the energy programs, how our clients have access, how they can apply for the program, and our community partners that are involved during the LEAP season that assist us in the community with the LEAP program. So if you have any questions about the plan, I'm happy to answer them. We would need board approval in order to forward this to the Department of Health and Human Services.
All right. We are familiar with the energy plan. Can I have a motion to accept and move the plan forward?
I'll make a motion that we accept Brian's recommendation that we move forward with the energy assistance plan.
I'll second that.
All in favor?
Aye.
Thank you.
Thank you.
Thank you, Brian. Next, we're going to have the director's report.
So I'm happy to report that we'll be seeing our new employees again tomorrow morning. We've kind of changed up our new employee orientation. We're doing it quarterly and actually having them come to the auditorium and doing a breakfast and a meet and greet with them. I think that will allow them to meet each other, maybe do a little networking, as well as celebrate them coming to Pitt County. So we're excited for that. At the end of this month, we're going to be doing the Social Services Institute training. July 31st, August 2nd. So we have a variety of people from the agency attending. And this is the and I actually didn't realize this last year when I went, but it is a huge training and opportunity for all the social service departments in North Carolina. There's varied informational meetings, just updates on things that are happening in the state. So it really, it's probably one of the best trainings I've been to since I've been in North Carolina. It's very informative, and it also gives me a chance to network with some of the other directors as well, so I look forward to it. I also have one other piece of, I'm going to go over the vacancy report, but this made my day today. I received an email from D Health. We have completed our goal for daycare, the daycare and childcare wait list. We no longer have a wait list. It is history-making, as Dee said, she cannot think of a time where there has not been a wait list for our county. So this really is a testament of the workers' dedication, expertise, teamwork, and commitment to the citizens of the county. And I just felt as though it truly was a celebration that they were able to achieve this in a relatively short period of time. So I'm just really, really proud that they've been able to do that. I think the daycare portion and childcare is so important for our children, and getting them hopefully a good start before they start school, as well as giving parents a place that's safe for their kids to go when they're at work. So I couldn't be happier. And our vacancy report. So I'm gonna go through the list of vacancies and then our hires in process. So for economic services, we have 17 vacancies. Family support services, which would be daycare, Work First, and child support, there's 1. Child welfare, we have 8. Adult services, there's 1. Admin and fiscal, there's 2. And legal, there's none. So our hires in progress for economic services is 4. Family support services, there's none. Child welfare, we have 2 in progress, and all the rest, there are none. So we have a total now of 29 vacancies. If the 6 come on board and the hires are in place, we will have 23 vacancies. But as Brian noted, we're constantly doing interviews, jobs are being posted. So I would love to sit here one day and report that we have no vacancies, and that's what I'm really wishing for. And it's not just bringing people in, but being able to create a work environment and a workplace where they'll want to stay. Okay, that's the end of my report.
Thank you. At this time, do we have any board member comments?
I'll just say that I'm really excited to hear about the child care numbers. I know those ladies and gentlemen in that department work really hard, so that's exciting. And also with the economic services update, just hearing the update about the Medicaid processing and noticing that those, it's increasing the amount that is being processed. So it's really good to hear.
I will just echo that. Brian, I know that you have stood at this podium many times when I have asked you about, hey, what are we looking like with Medicaid staffing? When is that coming? What's happening? And you wasted absolutely no time, and you have jumped in to make that happen. And you've just worked really, really hard with short amounts of time. I mean, when that was approved, you moved quick. And I think we're seeing the fruits of that labor right now. So thank you for that hard work, and thank you to all of your staff for their hard work. And I might be wrong, but didn't we have the longest daycare waiting list in the state?
Yep.
And now we don't have one, so that's pretty incredible.
It is.
Oh, wow, you all stole my comments. I'm sitting here. Man. Got some
I mean, it's
X-ray-
worth saying again.
X-ray vision eyes over there or something. No, I'm honestly happy and looking forward to welcoming my new team and working with you all over the next year. I think we all bring a different perspective and expertise, so I'm looking forward to you all utilizing that over the next year.
I'm excited for you to be a part of it.
Thank you. Certainly going to use yours.
Yeah. Okay, so now we have closed session. So what I'll do is I will read the statement, and then I will need a motion to go into closed session. So it is being suggested that the board go into closed session to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or an employee. And also to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or of the United States, or not considered a public record within the meanings of Chapter 132 of the General Statutes.
I make a motion that we go into closed session.
Second the motion to go into closed session.
All in favor?
Aye.
All right, welcome back. We're out of closed session.
As the community knows from watching recent meetings, we have had a couple of closed sessions recently, and I'd like to make a motion that we approve the minutes that have been reviewed for the recent closed sessions.
I second that.
All in favor?
Aye.
Okay.
Motion to.
Got anything else?
Mhm.
I will also make a motion that we adjourn this meeting.
Second?
Second the motion. to
All in
adjourn
favor?
this meeting.
Aye.
Stand adjourned.